My journey into the academy was that I always was passionate about economics, and particularly economic development, because I grew up on the American border, very close to Mexico. And it was always startling to me how on one side of the border we could be having one lifestyle, and people just across that border could have a very different lifestyle. So when I went to university, I studied economics and did my PhD and moved into the area of economic development and specialized in the Middle East. But as I did my work in the Middle East, I came to realize that economics is very much impacted by the well-being of populations and productivity. It's not just about education, it's also about health and well-being. And as we've seen today, in the world we live in, health and well-being probably trumps anything else in terms of defining the populations. So I went back to school after getting a PhD in economics and did another master's degree in health economics and pharmacoeconomics so that I could move over into health and health care. And it's been a very rewarding journey. I think that there's so much that needs to be done. I'm very passionate about education and an educationalist, and so training the next generation of healthcare managers and leaders is something I feel very, affected by. I enjoy, and I love the atmosphere of working with people and helping to give them those aha moments. So I think the most important moment in my career was when I started this role as the director of the Global Business School for Health. It was a moment of coming together of much of what I've done across my career, having had the opportunity to be a higher education leader, as well as working in the NHS, and also my background and my education, both in economics and in health economics in particular. Having the opportunity to lead an interdisciplinary school that brought health leaders and people with business backgrounds together to think about the challenges, not in the silos that we're so used to in the academy, but to think more broadly at the intersection of business and health couldn't be a better place for me, given the diversity of my career. And then moreover, having that global edge, because I have studied across the globe. I've worked in many different countries. I've traveled extensively. So, and noting that health systems vary from country to country. And so being able to pull together a group of academics, world-leading academics who represent that mosaic of the world and the world's health system has been a tremendous privilege for me. So the field of health and healthcare are evolving at an exponential rate. We're talking about a sector that was very static for a long time, focused very much on a hospital model, as it were, and therapeutics and treating diseases that we knew. It wasn't just COVID. The decade before COVID, we started to see lots of change in the sector, and COVID made that happen much quicker. So today what we see is a sector that's shifting and changing in ways that couldn't have even been imagined, say, 20 years ago for healthcare. It's very exciting. It's a field where people need to be agile and flexible and willing to take on other ideas. But more importantly, they need to be able to collaborate, because in this new health economy, the ecosystem of health has changed tremendously. The players have changed. We see big tech coming in, playing a very important role. And of course, that digital transformation is integral for all of our health and well-being going forward. We see that biotech and pharmaceutical management is an area that's so important, and pharmaceutical industry is changing. So these things require students to have a different skill set. And then moreover, we see a movement away from hospitals, trying to keep people at home and in their communities. And to do that, we're going to have much more of a focus on primary care, prevention, diagnostics. And again, many of the changes that we're seeing in technology, and particularly digital technology, will help us prevent and diagnose illnesses sooner. So if you're thinking to be a health leader, a health manager, then you have to be able to embrace change. You have to be a change maker. You have to be an innovator. You have to be willing to listen and collaborate. And collaboration is going to be terribly important in terms of your skill set, because no one sector, no one discipline can take on the challenges that we see today with aging populations and non-communicable diseases and climate change. All of these require us to work across and together, both in terms of the life sciences, medical sciences, and population sciences, and of course, business and management. So those people who are going to come through this program are going to get those skills. They're going to have that opportunity to think out of the box, to sit in classrooms, to have peers who are different than we've ever seen before in a typical class in business, because they will all have that passion for health, but they'll be looking for a business education to complement that.